Buckingham Palace this week confirmed that the Queen has tested positive for coronavirus. Thankfully, the palace is more than prepared to treat Her Majesty, as one of her former doctors can attest.
So at Buckingham Palace, and in fact at all her residences, she has access to medical care. And at Buckingham Palace in particular, we have a dedicated medical facility within the Royal Mews. In the actual medical centre there, you've got your GP. There's a GP on call all the time. Essentially, you've got the Queen's Apothecary who runs the medical team, and then you've got the head of medical household who's a consultant that works outside the hospital, and then we have a list of consultants that are on what we call the Queen's list. So they would be people that members of the family and staff, etc., can be referred to. So, that there's an in-house team, and then there's an extensive hospital-based consultant list. So whatever is necessary is available.
Dr. Anna Hemming was an in-house GP for the Royals for 7 years, giving her a unique insight into the household's medical facilities.
The medical team will be doing exactly what they would do when anybody is unwell, and they'll be making sure that first of all she's comfortable and she has access to the particular people that she would need to speak to whenever she might need it. Obviously COVID is a very different thing now to what it was when it first came out, and the virus has changed and become a lot maybe more virulent but less specific in its actions. And although the Queen is older than the majority of the population, the symptoms that she will be experiencing will likely be very similar to the normal cough, cold, etc. that most people are experiencing with the strain that's around at the moment.
The famously stoic Queen has cancelled virtual engagements following her diagnosis, a decision Dr. Hemming believes is the right one.
I think you have to remember she's in her 90s, and she'll be, suffering just like anybody who's got COVID, with maybe feeling a bit tired, maybe some other symptoms. And I think it's the right thing for her to do. She needs to rest.
Should her condition worsen, there are procedures in place to get her the care she needs.
If you've seen with other members of the royal family, when they need medical care that's very specific, they have access to the consultants, the hospital facilities that they need. And I think what's important to remember is that the best place to treat a patient, no matter who that patient is in a dedicated place where all of the treatments, etc., are available and at hand. So yes, there are lots of things that can be managed within all of her residences, but there are also things that she would need to be in a medical treatment centre for, just like any of the heads of state across the world.
As for the rest of the royal household?
I'm sure that they're all doing their regular testing and that they've all been vaccinated, which means that if they do get COVID, regardless from whom, that the actual experience is much less. She will obviously be being looked after, just like all of the people who have COVID are being looked after wherever they might be, whether that's self-care or having some help with things. I think she will be looked after very, very well, just as she is on a daily basis.